Hello everyone, I am Dr. Hollish D'souza. I am a medical oncologist. Today I want to talk to you about bladder cancer. Why bladder cancer? Bladder cancer is the 10th most common cancer worldwide. It is a cancer of the elderly. The median age is 60 to 70 years. It is associated a lot of morbidity. When I treat bladder cancer, I want to know two main important things. One is what is the fitness of the patient. Second is what is the stage of the patient. The stage is mainly of two types. One is called as a non-muscle invasive or an early bladder cancer, and the second is a muscle invasive bladder cancer or a slightly advanced bladder cancer. Today I'll be talking about MIBC, that is a muscle invasive bladder cancer. The treatment of MIBC is cystectomy, treatment of choice. A lot of patients are not eligible for cystectomy, that is a bladder removal and a reconstruction. So for such patients we go for radiation. If you're planning a cystectomy, the treatment of choice by guidelines and by trials is neoadjuvant chemotherapy followed by cystectomy. Neoadjuvant chemotherapy is chemotherapy prior to surgery. The standard of care of neoadjuvant chemotherapy has changed. It was initially a chemotherapy doublet medicine called gemcitabine cisplatin. It is now a combination medicine called DD-MVAC. DD stands for dose dense MVAC. MVAC includes a list of 4 medicines. They are given at 2 weekly intervals. The backbone of these both chemotherapy is a medicine called cisplatin. Cisplatin is a medicine that is given by IV. Cisplatin eligibility is one of the cornerstones for eligibility for neoadjuvant chemotherapy. If a patient is not eligible for cisplatin, we cannot give neoadjuvant chemotherapy to such patients, and then we proceed to bladder surgery, that is a cystectomy directly. So why cisplatin eligibility? Cisplatin eligible means the patient has to be able to metabolize cisplatin. For that, he has to have a creatinine clearance, that is a good renal function, a creatinine clearance of more than 60. Cisplatin has ototoxicity, so patient has to have a good pure tone odometry findings. He has to have a good cardiac functions, that is classified as an NYHA at least 2, and he has to have a good performance status. A performance status of 0 to 1 is an ideal cisplatin eligible candidate. Cisplatin eligibility makes a patient eligible for both GemCis as well as DD-MVAC. A young fit patient, a well-preserved patient, we want to push for a DD-MVAC regimen. DD-MVAC is now coming up to be the standard of care. If DD-MVAC is not possible because of logistics or because of certain conditions in a cisplatin eligible patients, we then proceed to gemcitabine and cisplatin. Post gemcitabine and cisplatin, there is evaluation again, and the patient is then taken up for cystectomy.